Welcome to the most comprehensive video guide on cesarean sections you'll ever encounter. A cesarean section, commonly referred to as a C-section, is a surgical procedure used to deliver a baby through incisions in the abdomen and uterus. Obstetricians typically recommend a C-section when a vaginal delivery isn't possible or safe for the mother or baby. One of the most common reasons for a C-section is when the baby is in a breech position, meaning the baby's head is up and feet are down. Similarly, a transverse lie, where the baby lies sideways, also necessitates a C-section. It's also advised if the mother has health conditions such as diabetes or hypertension that could complicate a vaginal delivery. Placenta previa, where the placenta blocks the baby's exit route, preterm labor, or conditions like the umbilical cord wrapping around the baby's neck, are all situations where a C-section becomes the safer option. Moreover, if a normal vaginal delivery presents complications, healthcare providers may consider a C-section as a viable alternative. Previous C-sections, risks of uterine rupture, or a baby being too large to deliver vaginally, macrosomia, are additional factors that might lead to opting for this procedure. Now, let's explore what happens during a caesarian section. Preparation starts with blood tests and detailed investigations, including determining the blood group to ensure blood is available if needed during the surgery. An anesthesiologist will review these results and assess your suitability for anesthesia. After all preoperative checks are completed and consent forms are signed, you're taken to the operating theatre. Dressed in hospital attire, you'll be prepared for anesthesia. Options include a spinal block, where you'll be awake but numb below the waist, achieved through a one-time injection between the vertebrae in the lower back. An epidural is similar but involves placing a catheter for ongoing medication delivery, allowing for adjustments and additional pain relief post-operation. General anesthesia is another option, where you'll be asleep and unaware of the procedure. Monitoring equipment will be set up to track your blood pressure, pulse, oxygen saturation, and heart rate. The anesthesiologist will then administer medication to induce unconsciousness, supplemented by oxygen to maintain saturation. If necessary, intubation will be performed, especially for longer procedures. The surgical team then cleans the area with an antiseptic solution. The first incision is made in the lower abdomen, followed by a second through the abdominal muscles. The uterus is then exposed and incised horizontally to deliver the baby, head first, followed by the feet. After delivery, the umbilical cord is cut, the placenta removed and examined, and the uterus and abdomen are meticulously sutured closed. Post-procedure, you'll gradually be brought back to consciousness and moved to a recovery area until you're alert and stable. Meanwhile, the baby is cleaned and brought to the parents for that precious first skin-to-skin contact. This video has walked you through the journey of a C-section, from preparation to recovery. If you have any questions or need further clarification, our doctors are here to help. Feel free to reach out by commenting below.